Now, you may ask yourself, well, so what? What do you do with these data when you establish at what ages people die and also from what causes? What practical use have they had, or what impact have they had? Well, I want to give you 3 quick examples of contemporary impact of these statistics. And the first one is lung cancer. Now, lung cancer was described in the early statistics as actually quite a rare disease. But around 1920 or so, in the US and the UK and Canada, the officials started noticing this colossal increase in lung cancer death rates, particularly in men. And no one had an idea as to why this was. This was a rare disease suddenly that became very common. And the UK Medical Research Council decided to investigate, and interestingly, it commissioned these 2 young epidemiologists. One was Jeffrey Rose, and the other was Richard Dahl. And almost by flipping a coin, they assigned Dahl the idea that, well, perhaps it's smoking that's causing this big increase in lung cancer. And the flip of the coin meant that Jeffrey Rose was assigned the alternative hypothesis, which was exhaust fumes from cars. So they said, all right, you two, get out, do your work. Both of them came up with very similar methods to try to investigate what the cause of this excess was. And Dahl, working with Bradford Hill, published in 1952 a famous paper that described that smoking was the major cause of most of the lung cancer deaths. And about the same time in the United States, Ernst Winder had come up with almost exactly the same findings. So what happened as a result of this? Well, when they first published the results, they were so clear, but people didn't believe them. They said, how can it be something that we've smoked? How can it cause disease? And there were so many skeptics. But Dahl and others kept at producing more data, such that by the 1960s, there was evidence that smoking was not just a cause of lung cancer, but of many other diseases. And that sparked, eventually, a huge decline in smoking in Western countries, such that in England, the death rates in middle age, say age 30 to 70, from smoking are half today of what they were just a few decades ago. So that's one example. Just the routine observation of colossal increase in lung cancer led to what has been a revolution and a simple finding of smoking being linked to disease. And as a result, millions of people have quit smoking in high-income countries and have probably avoided millions of deaths. A second example is a much more contemporary one, which is HIV/AIDS. HIV/AIDS wasn't a recognized disease till about 1980. And around that time, the US Center for Disease Control noticed a strange pattern of young men, particularly in San Francisco and in New York, dying of very weird diseases, dying of weird infections that really didn't exist in other places, or very unusual cancers. So they reported this in one of their bulletins, and eventually in the New England Journal of Medicine, characterizing this pattern. And about the same time, other places started reporting very similar disease patterns, including in Africa. And this quickly became clear that this was an infection, and particularly that it was a sexually transmitted infection that was first occurring in the gay male population of San Francisco and in New York and also overseas. And that led to the identification of HIV/AIDS. Within a few years, 2 biologists, one in the US, one in France, had discovered the virus that had caused this disease, and that heralded the onset of the worldwide HIV/AIDS epidemic. So that's the second example, that simple statistics. just as an anecdote, fast forward a little bit to just 2 years ago in Mexico, when the H1N1 virus was first reported, and the first reports showed a very high death rate among those that had been exposed to this virus. And this set off a worldwide alarm on how many deaths occur from H1N1. Now, it turns out later that the flaw in the Mexican statistics at the outset, that they actually had people dying from other things besides H1N1, led to this overestimation of how serious H1N1 actually was. I mean, it does cause disease, but it doesn't kill. And WHO recently has acknowledged that if they had better cause of death data in Mexico at the outset, the world would have actually acted quite differently than it did. So to summarize, cause of death statistics are not just dry numbers that our demographers and epidemiologists get excited about. They're at the heart of public health. They're at the heart of both discovering new diseases, such as AIDS or smoking related, but also tracking important diseases such as progress against cancer or heart disease.